So in this video, I'm going to talk about celiac disease. Your Nclex test is incomplete without celiac disease because they're gonna ask you a lot of questions on celiac disease. So I will try to explain you in simple words what is celiac disease. And you have to connect all dots together like dot 1 to 2, 2 to 3, right? In order to understand celiac disease. So what is celiac disease? So celiac disease is an autoimmune disorder. So now you must be wondering what is autoimmune means, right? So autoimmune means when the body attacks its own cells or tissue. So why it happens? So this is triggered by the consumption of any gluten products. So you must be wondering what is gluten means, right? So gluten means it's a protein that is found in bro diet. Bro means barley, rye, oat, and wheat. When you eat this kind of product, it has a gluten, a protein, and when you eat this, it will uh, it will destroy your villi in small intestine. It will damage your villi in small intestines. So villi is a finger like project, like, right, finger like thing. So the job of villi is to absorb nutrients so it can push in your bloodstream all the nutrients. But over the time your villi is gonna like is supposed to absorb nutrients, right? But when you eat gluten products, it will damage it. It will damage the villi, right, in small intestine. So the nutrient will not be absorbed through villi. So that is called celiac disease. So when villi is damaged, what it's supposed to do like this, but right now it's in flat, right, over the time. So what symptoms we're gonna see in the children, and as well as what symptom we're gonna see in the adults. So in children, what we're gonna see symptoms? We're gonna see diarrhea, which is very important point of view for Nclex. We will see diarrhea. We will see statoria. Statoria means a foul, fat, smelly bowel movement, yellow shiny bowel movement. That is an important thing. You will see abdominal pain, bloating, and distension. You will see nauseated, patient don't want to eat something, anorexia, weight loss, failure to thrive, right? And you will see slow growth. You will see slow growth or delay puberty in the children. And in adults, what we gonna see? We're gonna see headache, anxiety, depression, tiredness, joint or bone pain, and very itchy skin blister rashes called dermatitis herpetiformis. Dermatitis herpetiformis. That thing you're gonna see in the adults. So those were the symptoms of celiac disease. You have to connect each dot together. If I did not mention any symptoms, but during your NCLEX exam, if you see it, if you see weight loss versus weight gain, you will automatically choose weight loss because nutrients are not absorbed in the body, right? So patient will of course have weight loss. So if I did not mention any symptoms, you have to figure it out. Like patient is not patient of course gonna lose the weight and may don't want to eat something, right? Next thing, what's going to happen next? So how we going to confirm this diagnose? So first thing, the doctor is going to order the blood test. That's the first thing. Initial step is blood test. So in the blood test, what they're going to looking for? They are looking for anti-tissue transglutaminase, TGE, TTG, IgA antibody. So they are looking for that. If that is positive, then the doctor is gonna order diagnostic test. What they're gonna do? They're gonna do endoscope. They're gonna do endoscopy and they're gonna get biopsy from the small intestine. So how they're gonna do? They're gonna insert the camera through your mouth. That's called endoscope, right? So they're gonna go and they're gonna do small biopsy from the small intestines. So if that is positive, that's how they're gonna confirm the diagnose of celiac disease. So now let's discuss about nursing interventions. So what we're gonna focus on? We're gonna focus on their nutrition, we're gonna focus on their hydration, and we're gonna focus on their growth. Three things are very important. Nutrition, as they are not, as the nutrients are not absorbing well, so we're gonna focus on their nutrition because they are having too much diarrhea, nauseated, losing a lot of fluid, right? So we're gonna focus on their hydration, and same time we're gonna focus on their growth. Make sure they are they have good amount of weight and they are good amount of height and they are developing well. So those are the three things we're gonna monitor. So now the biggest question is what can they eat now and what they have to avoid. So during your Nclex exam, the main thing you have to remember that they cannot eat gluten at all for the life. They cannot, celiac disease patient cannot eat gluten for their life. They have to eat gluten free diet forever. So that's mean the bro diet, they have gluten. You have to remember bro diet, they cannot eat bro diet. Bro diet means B for barley, R for rye, O for oats, W for wheat. And I also add number 5, N. Brown, right? Brown means BROWN. N means no, they cannot have. Because during your NCLEX exam, you're going to forget, do we have to give bro diet or we do not have to give? So just remember brown. Last N means no, you don't have to give bro diet. They have to eat gluten free diet. So tell your patient whenever you're buying products, you have to read the label very carefully. If it has gluten, then avoid it. So I'm gonna post the picture, I'm gonna post the food that is they can consume and they should not consume. And but mainly they have to avoid bro diet based for your NCLEX exam, you must remember. And the thing is they can eat rice, corn, potato, beans. There are plenty of food, but during your exam you must know all foods that they can have, because that is a main part of your NCLEX question. They can ask you all about food related question, what they can have and what they cannot have. So those are the important. They should avoid again bro diet. If celiac disease left untreated, it can cause serious complication. It can cause anemia, low level of iron, B12. It can cause infertility and brittle bone due to the destruction of the villi, right? So when this happens, they need minerals and vitamin like folic acid, iron, and fat solubles like vitamin A, D, E, K. So what precaution do we have to take with celiac disease? So celiac disease is not any infectious disease, so you don't have to take any spe- uh, any special precaution. Only standard precaution is good enough to take care of celiac disease patient. So that's the wrap up of our celiac disease. So now we're gonna go over around 18 to 20 practice question, and I hope with that information you will be able to crack all of your answer immediately, because there are 18 to 20 questions. So we're gonna go super fast speed. And this question does not belong to me. I was able to get from the online. So whoever created this question totally credits to them. So nothing belongs to me. I'm just using this for study purpose, just for learning purpose for you guys. So let's start. So let's do practice questions. We're gonna go a little bit faster, okay? So the nurse is caring for a child with celiac disease. The child was started on prescribed gluten-free diet 2 days ago. Which should the nurse expect to find? So if they change the diets, that means the patient will have improved appetite, right? So answer C is your final answer. Because in celiac disease, the patient don't want to eat something that's called anorexia. But as you change the diet, the patient want to eat. So that's when improved appetite is the right answer. Right. A client with newly diagnosed celiac disease asks why they have chronic diarrhea. What is the best explanation? So that's mean when their villi is damaged, right? Why it happened? Because answer B is your final answer. Autoimmune destruction of intestinal villi. When this happen, the patient will have symptom of diarrhea, as I mentioned. So answer B immediately is answer correct. Which diet is best for patient with celiac disease? So they have to avoid bro diet, right? So what is our diet they can have? They can have rice, corn, potato. I will post the food that you need to know what is the okay to give and what is not okay to give. So rice, corn, and potato, they are okay to give. A nurse is providing dietary teaching to a client newly diagnosed with celiac disease. Which of the following food should the nurse instruct the client to avoid? What you have to avoid? You have to avoid the bro diet, right? So barley soup you have to avoid. That is B for barley, right? Hmm. The nurse is teaching a client with celiac disease about food allowed on gluten-free diet. Which food can the client safely eat? So they can eat brown rice, yes. Corn, yes. Scrambled egg, yes. You have to avoid barley soup and whole wheat bread, right? Right. A patient newly diagnosed with celiac disease asks what food to avoid, which response by the nurse is correct. So you have to avoid bro diet, right? Which is answer B. Avoid barley, right? Oat and wheat. See they're gonna just twist the question, but answer is gonna be same. Which part of the intestine is primarily damaged in celiac disease? So duodenum is the one damaged during your celiac disease. Answer C. Which lab finding is most expected in untreated celiac disease? So as I mentioned, the patient will have low level of iron, anemia, or and B12, right? So answer you will see low level of iron, which is answer B, low ferritin. Low ferritin is same as low level of iron. A nurse suspect celiac disease in a patient with which finding? So they're gonna have again answer B, iron deficiency anemia, resistant to supplement, right? The nurse is preparing a room for patient who has recently diagnosed with celiac disease. Which of the following precaution does she know to place in patient on? So this one, as I mentioned, this is not any infectious disease. So standard precaution is your final answer. No contact, no droplet, no neutropenic. Standard. A 2-year-old child is diagnosed with celiac disease. Which of the following food should the nurse instruct the patient to avoid in the client diet? So they have to avoid wheat, BROW, right? W for wheat. They have to avoid wheat. A patient is suspected to be suffering from celiac disease. The physician order on endoscopy. If the patient has celiac disease, which finding will they discover with the endoscopy? So what they're gonna do in the endoscopy? What they're gonna find? They're gonna find flat intestinal villi. As I mentioned, villi does that, right? But damage over time it will cause flat intestinal villi. That's right answer. A patient who recently diagnosed with celiac disease has blister type bump on the elbow and knees. The patient report it is extremely itchy. As a nurse, you know this is, as I mentioned, this is dermatitis herpetiformis. So that is your right answer. You will see that rash, dermatitis herpetiformis. An important nurse consideration in the care of a child with celiac disease is to, what you gonna do? You're gonna refer to a nutritionist for detailed dietary instruction and education. Which diet is appropriate for a child with celiac disease? So they have to be in gluten-free diet forever, right? A nurse provide dietary teaching for a client who has celiac disease. Which food would be allowed in their diet? Select all that apply. So what is allowed? Rice allowed, yes. Eggs okay. Potato okay. Fresh fish okay. Dried beans okay. Barley soup and wheat bread not okay. A nurse is assessing a child with undiagnosed celiac disease. Which clinical manifestation are most commonly associated with condition? So what is expected symptoms? Fat, foul smelling stool, yes, steatoria, right? Weight gain, no, no. We gonna have weight loss. So answer A, abdominal distension. C, yes. Bloating, yes. Chronic diarrhea, yes. Pallor and fatigue, yes. So except B, all are correct answer. A child with celiac disease is admitted with severe malnutrition, right? The nurse anticipate which priority intervention? So you have to immediately initiating a gluten-free diet. That would be your right answer. You have to change the diet, initiating a gluten-free diet immediately, because if you give more gluten, it's gonna damage more. A nurse is caring for 10-year-old child recently diagnosed with celiac disease. The child asks, "Will I have to follow this diet forever?" What is the best response? So the best response is yes. Celiac disease is a lifelong condition, and eating gluten can cause serious complications. So that is your best option, B. So that's come to an end of our question and answer practice, question and answer, right? So I hope go over with this video one more time, and I hope you will get good foundation and you will be able to crack a lot of answers when you see question about celiac disease. Good luck.